morning, Mr. Smith. My name is Shannon Smith. You can call me Shannon. I'm a nurse practitioner student with George Washington University. I'll be doing your exam today.
Okay.
All right, do you have any questions or concerns before we get started?
I do not.
Okay, I'm just going to wash my hands here. And before I start the exam, I'm just going to note Mr. Smith's overall appearance and his posture, his overall nourishment and hygiene, his facial expressions, mood, affect, any facial asymmetry or abnormal body movements. And we're going to get going here with the neuro exam. I'm going to start by having you tell me your full name.
Scott Smith.
Okay, and your date of birth.
1/21/86.
Okay, and can you tell me the date?
It's March 4th, 2017.
Good. And what building are you in?
I'm in a house.
Okay. We're going to test recent memory. I'm going to have you tell me what time your appointment was today.
10 a.m.
Okay. And remote memory, what did you do for your last birthday?
Dinner with friends.
Okay. I'm going to test cerebration. I'm going to have you spell the word world backwards for me.
DLROW.
Okay. And we're going to test reasoning. I'm going to have you tell me how apples and oranges are alike.
They're both fruit.
They're both fruit. Good. I'm going to have you put your hands then on your thighs there. And I'm going to have you just move them back and forth like this and do it as fast as you can. All right, great. I'm going to have you then take each one of your fingers and touch it to the distal aspect of your thumb, back and forth. Good. Excellent. I'm going to then have you take your finger, touch my finger, and touch your nose. And then do it again with the other hand. I'm assessing for any intention tremors and any abnormal movements, but all his movements seem smooth. And now I'm assessing for resting tremors. Again, I don't notice any abnormal movements. I'm going to then have you take your right heel and move it down your left shin, and again on the other side. Good. I'm going to have you close your eyes and tell me what direction I'm moving your finger.
Up. Down.
And cross your legs for me. And do the same with your toes.
Up. Up.
Good. You can open your eyes. I'm going to next test sensation. So I'm going to use this to test. This is what sharp feels like, and this is what dull feels like. Okay? I'm going to have you close your eyes and just tell me what you're feeling.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay, good. Next, I'm going to just tell me if you can feel this. Okay, again, keeping your eyes closed.
Yes. 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 Yep. Yes.
Okay, excellent. Okay, I'm going to test vibration sense. So I'm just going to have you again keep your eyes closed here and tell me if you can feel this.
I can feel it.
And what does that feel like?
It's vibration. Yep, I can feel the vibration.
Good.
I can feel that vibration. I can feel that vibration.
Good. So I'm going to place two objects in your hands. Again, with your eyes closed, just tell me what this object is.
It's key. It's pen.
Okay, great. All right, I'm next going to test your reflexes. So I'm just going to have you relax your arms there on your legs, starting with the brachial tendon there. There we go. Good. And your triceps tendon. Brachioradialis. Okay, good. Just relax. Good. And then test your patella tendon here. Good. And your Achilles tendon. And I'm going to assess for your plantar reflex here. Good. Good. Okay. We're now going to take a look at your upper extremities here. I'm going to just take that from the next part of the exam. I'm going to first note any scars, lesions, any moles or anything like that. I'm going to assess skin color and temperature. I'm going to note hair distribution, any edema. I'm going to test the cap refill of all his fingers. It should be less than 2 seconds, and it is. Okay. I'm going to just test muscle tone here and notice muscle bulk or any areas of atrophy, which I don't. I'm going to then inspect his spine, noticing the contour and shape of his spine, any tattoos, scars, or lesions. I'm going to then start by inspecting his spine. I'm going to, or palpating his spine with the cervical spine. I'm going to palpate the cervical spinal processes and the facets, and then I'm going to palpate down on all his spinal processes, noticing any step-offs or areas of tenderness. Does that hurt at all?
No.
Okay, good. I'm going to end at the sacroiliac joint here and just push on that. Does that hurt?
No.
I'm going to palpate the paravertebral muscles and the sits muscles. Good. I'm next going to test for percussion tenderness of your CVA. So I'm just going to pound here on your back. Just tell me if that hurts.
No. No.
Good. Next, going to inspect your shoulders and the position of your shoulders. I'm going to palpate out here to your acromion. I'm going to note any tenderness, warmth, or crepitus. I'm going to palpate your scapula up to your acromion, down to your coracoid process, your biceps tendon, your greater tuberosity there, your bursa. Good. Does any of that hurt? I'm going to do the same on this side. Good. We're next going to do some range of motion. Flexion is first, so I'm just going to have you bring your shoulders out and up, down, and all the way back. Good. Adduction and abduction, so bring your arms out. Good. And your shoulder across like that, and across. Internal and external rotation. Bring your shoulder, yep, good, and do the other side. Good. All right, and then I'm going to have you do external rotation by bringing your arms up and down. Good. Any pain there?
No.
Here, we're going to test strength. First, I'm going to have you just shrug your shoulders against resistance. Good. And then I'm going to have you put your arms out with your thumbs down. Don't let me push here. Okay, good. And your thumbs up like that. And I'm going to push in. Don't let me. Good. Next, going to inspect your elbows, noting any areas of redness or swelling. I'm going to palpate the acromion and the epicondyles for pain, tenderness, or crepitus. I'm going to palpate the brachial pulse and the epitrochlear lymph nodes. Okay. I'm going to assess range of motion. I'm just going to have you bend and strain your elbows. Good, and then keeping your elbows bent, I'm going to have you put your palms out and just turn them up and down. Okay, good. We're going to next assess strength, so hold on here. I'm going to pull, don't let me. I'm going to push, don't let me. Good. I'm going to pull, don't let me. I'm going to push here, don't let me. Good. Next, going to assess your, or inspect your hands and your palms. I'm going to palpate them here. Your radius and ulna, your anatomical snuff box, your carpal bones, your MCP joints. I'm going to push for any bogginess. Your PIP joints and your DIP joints. Any pain there?
No pain.
Okay. I'm going to do the same on this side here. Okay, I'm going to then do some range of motion. So if you can just put your palms up, have you bring your hands up and down, and then straighten your hands and do in and out. Good, we're going to then do some strength. So go ahead and squeeze my fingers, don't let me pull. Excellent, put your fingers out like that. Don't let me squeeze them together. Good, and then turn your hands over, touch your thumbs. Good, and then I'm going to do do wrist strength, so put your hands out like this with your wrists up. Don't let me push down and don't let me pull up. Excellent. We're just gonna do some knee range of motion before we lie down. Extend your leg out, down, and that one, good. And this, then turn your feet inward and outward. Excellent. Go ahead and lie down for me. Good. Keeping you covered here, I'm just gonna inspect your lower extremities again, noting the skin color, any scars, lesions, or bruising. I'm gonna notice the hair distribution. I'm gonna feel the temperature. I'm gonna just push in and see if he has any edema, which he does not. I'm gonna note the cap refill of his toes. Good, and I'm just gonna note muscle bulk, and I'm gonna assess for tone here. Good. Excellent. I'm gonna then palpate the pulses of the femoral pulses, the popliteal pulses, and the popliteal lymph nodes. The DP pulses, the PT pulses and the DP pulses. Okay, I'm going to start by inspecting the hips, and I'm going to note for any instability in the hips or pain. I'm going to palpate the iliac crest coming down to the anterior superior iliac spine. I'm going to palpate your greater tuberosity, or tubercle of your femur, greater trochanter of your femur. Good. And then we're going to do some range of motion. So I'm going to put my arm underneath here. I'm going to have you bring your leg up and squeeze it into your chest. Good. And your other leg. Good. Now, we're going to check for external rotation. I'm going to bring your leg out and down. Good. And then adduction, abduction. And then internal and external rotation. Does that hurt at all?
Nope.
I'm going to repeat it on this side here. Any pain or tenderness there?
No.
Okay, good. And I then have you push up against my hands. We're assessing strength and down. Good. Up, down. Have you push against my hands and in against my hands. Good. Next, gonna assess the knees, starting with the suprapatellar pouch. I'm gonna note any swelling. You can go ahead and bend your knees for me to 90 degrees. Note any swelling, areas of redness. I'm gonna note the hollows of his knees. I'm gonna palpate the tibiofemoral joint outwards, palpate the menisci, the patella tendon, and the patella, the lateral and medial ligaments and the compartments, lateral and medial compartments. I'm going to do the same on the other knee. Okay, good. We already did range of motion while sitting up, but we're going to test strength here. So go ahead and kick out and pull your heel in. Good. Go ahead and do the same on this side. Any pain there?
No.
Okay, go ahead and straighten your legs for me. I'm inspecting the tops of the feet and the plantar sides of the feet. I'm going to then palpate the leg, noting any redness, swelling, or crepitus. I'm going to push on the joints, noting any bogginess. And in between the joints, moving the toes up and down. And do the same here. So we're doing the femur, or the fibula and tibia is what I'm palpating, the lateral and medial malleolus, and the ligaments, the Achilles tendon, the calcaneus, the tarsal bones, and the MTP joints, and in between the joints. Range of motion is next with your feet, so bring your toes towards your nose, there you go, and push your toes away. And then I'm just gonna do range inversion and eversion, just relax your foot. Any pain with these movements?
No.
Okay, go ahead and push on my hands, bring your hands towards your nose, excellent. Next, gonna inspect the abdomen, noticing the symmetry and contour of the abdomen, noting any scars. I'm gonna have you raise your head and give me a cough. We're looking for hernias or bulges. I'm gonna note the umbilicus. I'm gonna start by auscultating with the diaphragm in all 4 quadrants. Okay, and then with the bell, I'm gonna listen for bruits in the aortic area, the renal area, the iliac area, and the femoral area. Okay, excellent. I'm then going to percuss your abdomen in all 4 quadrants. I'm going to percuss down towards your bladder. Okay, percuss up the midclavicular line starting down by your umbilicus for your liver. And down to note where your liver starts. Okay, I'm going to see if I can percuss your spleen. And take a breath in for me. Okay, good. I'm going to then do a light palpation in all 4 quadrants, noting for any tenderness or guarding. I'm going to palpate over the bladder for any distension or tenderness. I'm going to palpate for any thrills in the aortic area and see if I can palpate the width of the aorta. I'm going to then deeply palpate all 4 quadrants, noting any abnormal facial expressions. Okay, I'm going to try to palpate the liver here. Take a breath in and out. Good. Sorry. And then let's do the spleen here. Same thing, just relax. Good. All right. I'm going to then have you sit up here. Go ahead and stand. I'm just going to do some range of motion of the spine. I'm going to note your posture. Go ahead and touch your toes for me. Okay, and stand up. We're going to flex back. Okay, good. I'm going to have you rotate your spine for me. Good. Does that hurt at all?
No.
And then, yep, side to side. Excellent. Good. I'm going to then watch your gait, so if you can stand over there, just walk a few normal steps. Good. I'm noticing his posture and arm swinging. Go ahead and walk back on your toes and come back on your heels. Good. I'm going to have you stand in front of me with your feet together. I'm going to have you then close your eyes, and I'm just going to notice any swing or abnormal body movements. And I don't notice any. I would do this for 30 to 60 seconds. All right, you can go ahead and have a seat. That is the end of our exam. Do you have any questions?
No questions.
All right, nice to meet you. Have a good rest of your day.
Thank you.
Just washing my hands before I leave.